Continuing on, according to the National Institute of Neurological Disorders and Stroke, this is a genetic disease. However, there's no specific gene for Asperger's syndrome that has been found yet. They are still working on trying to find out what initially causes the disease or syndrome, just like autism. But as of yet, they have not contributed or connected it with any specific medication, gene, anything like that. As far as treatment, there are no current treatments at this time. As far as medication, some of the other treatments you can do would be special education, behavioral modification, speech, physical, occupational therapy, social skill therapy, parent training and support to teach the parent behavioral techniques to use at home. Some of the local programs available is Birth to 3, which works with your child up to 3 years old. After that, they have the program that is called Talk and Learn, that is through the school district and also through, they coordinate with the Birth to 3 program. It is a program where your child goes to an elementary school for a certain amount of time, kind of like a pre-kindergarten or preschool, maybe from noon to 2 or maybe 10 to 1 or 10 to noon. And they work specifically with your child on either it's speech therapy, a physical therapy, cognitive. Each disability is a little bit different, and each child in the form of Asperger's is different, so they specifically take those needs to that child and work what works best for that child. According to WebMD, there's no medication. However, some medications can be used to treat specific symptoms such as anxiety, depression, hyperactivity, obsessive compulsive behavior, because all of those symptoms also affect the Asperger's. So by taking a medication for maybe anxiety, that can help decrease some of the symptoms of the Asperger's. With that, with effective treatment, children with Asperger's syndrome can learn to overcome the syndrome or disease, however you want to say it. The disability, they can still find social situations where it is either personal relationships or interpersonal that are still struggling. Many of the children that have Asperger's grow up to be adults who are working successfully in a mainstream job. They do at times still need encouragement and support, but with the support that they have around them and their family, they're able to overcome that and lead pretty normal lives. That is my speech and my informative speech on Asperger's syndrome. Thank you.